What if, after faithfully doing your job day after day, year after year, you got sick with a disease you didn't think you were at risk of getting? What if several of your coworkers got the same disease? And what if your doctor told you she thought you might be sick because of where you work? What if you later found out there was evidence of a link between your work conditions and the illness you got, but you had never been told? And what if your employer knew of this evidence, but had told you there was nothing to worry about? It sounds like a story of the past, of a place somewhere across the globe, without the kind of protections we come to expect in our society. In fact, it's neither of those. This is the story unfolding in my research at the Ambassador Bridge in Windsor, Ontario, Canada, the busiest border crossing in North America, where over 20,000 transport trucks and other vehicles cross each day. It's the story of a workforce of women whose work is done among high levels of diesel and vehicle exhaust, extreme air pollution, shift work, and dirty working conditions. And it's a workplace where women are getting breast cancer at rates 16 times higher than the rest of the country. I spoke with over 50 women workers from the Ambassador Bridge, doing in-depth individual interviews with 25 of them. In their stories were descriptions of where they get their health information, their knowledge and understanding of breast cancer risks, what it was like to work at the bridge. Many of those I interviewed knew that 1 in 8 Canadian women get breast cancer, but they were surprised that only about 10% of cases are genetic, and that 70% of breast cancers are among women without the known risk factors. Their sense was their environment was causing harm and there were high levels of breast cancer among them, but they were also trying to reconcile their employers' assurances that all was safe. They were concerned when faced with the science showing increased rates of breast cancer in areas with high vehicle pollution, shift work, and other exposures. Women told me responsibilities around breast cancer are not only personal, but also those of employers, governments, compensation boards, all Canadians. They want access to trusted information and resources on breast cancer and the research on the health risks of their jobs and the environment. They want to be able to make health protective decisions to prevent future breast cancers among their workforce and are hopeful that with public awareness and support, improvements and better protections are possible. My SSHRC-funded research can inform public health policy and environmental and workplace regulations by taking what was learned about how women access and use information about the science on breast cancer risks to create their strategies for breast cancer risk mitigation and primary prevention at the local level, across the country, and spanning the globe.